Good morning and welcome. Over the last 6 weeks, we have journeyed through the journey of VTE awareness, venous thromboembolism. We have learned about blood clots, the silent threats in our veins. And today is our final post where we recap what we have learned. Can you spot the clot? And can you stop the clot? So let's recap what we have learned over the last 6 weeks. Today is the final post 15, on the recap of what we have learned. We started by venous thromboembolism, saying that we have two types, deep vein thrombosis or DVT, where you have a clot in your legs and the clots can dislodge and move to the lungs, what we call PE or pulmonary embolism. So how do we recognize DVT? The key learning point was any unilateral leg swelling is DVT until proven otherwise. If you have swelling of one leg, think of DVT. So you have sudden swelling of one leg, there is tenderness in the calf, there is pain on walking, there may be warmth or skin changes in your leg. So unilateral leg swelling is DVT until proven otherwise. And the clot can dislodge and move to the lungs, what we call pulmonary embolism. We learned that pulmonary embolism is a great masquerader. Most of the time it's missed, treated as pneumonia or other causes. How do we recognize pulmonary embolism? We said you must think pulmonary embolism when you get sudden unexplained shortness of breath, sudden chest pain, worse on deep breathing, rapid heartbeat, palpitation, dizziness, fainting, and syncope. The key thing about pulmonary embolism is you must think of PE, sudden chest pain, sudden breathlessness, palpitations, difficulty in breathing, think of PE, and more so if you had a history of leg swelling. The other session we learned about why do we get clots. We said the three main risk factors for clot formation, what we call the Vilkos triad. One is endothelial injury, anything that causes injury to the veins. Number two was stasis, anything that causes immobilization or when you are not moving around will trigger clot formation. And the third major risk factor was what we call hypercoagulable states. The blood has a tendency to form clots. So who is at risk of getting clots? One of the key things, and we covered this in yesterday's post, was if you have had recent surgery or recent hospitalization in the last 3 months. So recent surgery, recent hospitalization, you are at high risk of clot formation and you should be put on blood thinners. So if you have recent surgery, hospitalization, and develop chest pains, difficulty in breathing, think PE. History of long travel or immobility. Remember our session on economy class syndrome. So if you have traveled for long, and we covered how we can protect ourselves. So history of long travel, immobility, long travel with planes. If you have been hospitalized for long, you must think. The other key we covered of people at risk are pregnancy and postpartum, and we covered a session about clots in pregnancy and also during the postpartum period, 6 weeks post-delivery. Those are people at risk. If you are pregnant, one leg swelling, think of a blood clot. If you are pregnant, sudden onset breathlessness, chest pain, you must think PE, among other things. We also said people who have cancer or are on cancer treatment are also at risk. Issues of people who are obese or have excess weight or also dehydration, people who are on hormonal therapy. There are also other chronic medical conditions like heart failure, patients with HIV. We know in the past with COVID, which was also associated with a lot of clot formation. And finally, there are also genetic disorders. Some people have a family history of getting clots. And these people at risk should be very vigilant, so that if you notice any symptoms, we have said one leg swelling, sudden onset breathlessness, chest pain, we must think blood clots. The key thing we have been learning in this series is about blood clot is you need to act fast, recognize the symptoms early, go to hospital, and start the right treatment early. We also went ahead to cover how do doctors treat blood clots. Once the clots are diagnosed, we said in diagnosis there are some tests that are done, and key to remember, if you have unilateral leg swelling, you need to get a Doppler ultrasound done, an ultrasound of the leg. We have other blood tests like D-dimers that we do. For the clot in the lung, the main test is a CT pulmonary angiogram. After diagnosis, we covered how doctors treat these deadly blood clots, and we talked of the blood thinners, the anticoagulants that we use. We should not fear them. Once used correctly, they help in treating the clot. And we said the current standard of treatment for blood clots are what we call the DOACs, direct acting oral anticoagulants like rivaroxaban, dabigatran. Those are the standard of care. Warfarin is no longer the standard of care of treatment of clots, except in such certain cases which we discussed. We also said there are some people who require thrombolytics, drugs to break down the clot if you have had a massive clot. Other measures to help with the treatment of clots are the compression stockings, which we said are very important, especially in preventing the complications like post-thrombotic syndrome. And key of treatment is regular monitoring and follow-up. You need to follow your doctor's advice. You do not stop your medications early. You treat in the right duration. If you require follow-up, follow your doctor's instructions. Lifestyle adjustment. Being active during long journey. Avoid long immobilization. Hydrate well. Those are among the key things we covered. And how can you prevent yourself from getting a blood clot? We said the things that we can do to prevent blood clot. One is stay active. You need to move during travel. If you are going for long distances, please go back to the post on the economy class syndrome where we covered how to prevent ourselves during long journeys. Stay active. If you have been admitted, ensure you are mobile. Get out of bed, sit up. Post-surgery, start moving early as possible so that you can prevent yourself from getting a clot. Stay active. Hydration. We said dehydration is also a risk factor. Those who exercise, ensure even moving, ensure you are well hydrated. Then wear compression stockings if prescribed. If you are at risk, ensure you get the compression stockings. And then stay alert, be aware. Once you notice the signs and the symptoms, please see your doctor. Seek medical advice. Don't just get leg swelling and you assume it's a muscle pull. Go see a doctor and get a Doppler done. One of the key things to prevention is being aware, and that's why we are having this VTE awareness series. And follow your doctor's advice and medication. We also had an interesting session where we covered about life after blood clot. How do you move forward after you have been treated? And we said for the majority of people, you can stay healthy lives without even a clot occurring. But there are a few who may develop a clot again, a recurrence of the clot. So we need to be vigilant. And we also said some of the complications that can occur. Please go back to those posts. We talked about post-thrombotic syndrome, where the legs remains permanently swollen. You get heaviness, you get swelling. And we went through how to manage patients who get PTS. We also talked of post-PE syndrome. A number of patients develop anxiety, develop worries that the clots are keeping on coming back. Please remember, with consistent follow-up, with healthy living, and now the clot prevention strategies, many survivors may not experience those symptoms. And if the clot occurs, we are able to pick it early and treat well. So we have learned a lot. I hope we can now spot the clot. And if the clot occurs, we can stop it early. And once you get a clot, know you can still live healthy lives after a blood clot. So what is the one thing you have learned from this VTE awareness series? Please share in the comments. Encourage others to follow the posts and stay tuned for other posts. Dr. Beatrice Muthui-Mutua, saving lives one heart at a time.